This is a huge day, and let me just start with a very quick story about a research paper I wrote 15 years ago with the most obvious result ever, which is that if you take sugar-sweetened beverages out of SNAP, kids get healthier. Thank you. Okay, I wrote the paper 15 years ago, and I forgot about it because no one did anything about it. This administration, for the first time, under the leadership of President Trump and Secretary Kennedy, is doing something about it, and not just on sugar-sweetened beverages, but on the whole food pyramid, fundamentally changing the direction of this country with the new dietary guidelines. It is one of the most significant resets of new federal nutrition policy I've ever seen. And I'll tell you, those 15 years were frustrating because the data were there and no one was acting. The difference in this administration is that we are now acting on the information that's there and changing it because we care deeply about the health of Americans. This moment reflects a restoration of common sense, scientific integrity, and accountability, much of it supported by research at the National Institute of Health. And they represent a clear break from decades of guidance that failed to improve the health of Americans. For too long, Americans were told to avoid protein, avoid healthy fats, rely on carbohydrates, and accept highly processed foods as unavoidable. I spent my youth scared of eggs. And then my family introduced egg whites because I guess those were better. Now, eggs are a superfood. You can see where they're not on the pyramid somewhere. They've got to be. Nearly 90% of healthcare spending goes toward treating chronic disease. More than 70% of adults are obese or overweight, and nearly 1 in 3 of adolescents are on a path toward diabetes. We can't go on like this, and with this new food pyramid, we are making a real dent. These outcomes are not inevitable. They are the predictable result of poor policy choices and nutrition guidance disconnected from real-world health. NIH research has consistently shown that nutrition is a central driver of chronic disease risk. Dietary patterns influence inflammation, insulin resistance, blood pressure, and are at the root of so many problems and diseases, including cardiovascular disease, obesity, diabetes, liver and kidney disease, cancer, cognitive health. If you want to make America healthy again, you have to address the food that we eat in this country. And for the first time in decades, you're seeing real change. I'm very pleased to announce also a cooperation that we're into an agreement that we're doing with the Food and Drug Administration for NIH research to work, because it's not enough just to say the science has spoken. There is no such thing as the science speaking. We have to keep doing excellent gold standard science. And so as this change is happening, we're going to make sure that it actually is working to make America healthy through excellent gold standard research. In this administration, what we want to do is use science for the good of the people and keep doing it and challenge dogmas in ways that fundamentally transform health, and that's exactly what we're doing with these new dietary guidelines. The dietary guidelines reflect science directly and clearly. They prioritize real nutrient-dense food, including high-quality protein at every meal, full-fat dairy without added sugars, vegetables, fruits, healthy fats, fiber-rich whole grains, and yes, even eggs. They take a firm stance against highly processed foods, added sugars, refined carbohydrates, and sugar-sweetened beverages. For the first time, the guidelines state plainly that no amount of added sugar or non-nutritive sweeteners is recommended as a part of a healthy diet, and that young children should avoid sugars altogether. Thank you. Under President Trump's leadership and Secretary Kennedy's direction, these guidelines recognize that healthy fats are not the enemy, adequate protein is essential for growth and metabolic health, and that certain individuals with chronic disease may experience improved outcomes with lower carb diets. This is not ideology. It's evidence-based, common-sense science. Finally, the guidelines matter because they inform nutrition standards across a whole wide range of federal policies, including school meals, military food systems, SNAP, WIC. The NIH's role has been to generate the rigorous scientific evidence that helps policymakers understand how diet influences health, and we'll continue to do that with continued gold standard research. The science is strong, and it continues to demonstrate that improving diet quality is essential to improving the health of Americans. And thank you for your time.